is clear. You can hear my voice.
Yes.
Is it clear?
Clear.
Okay, thank you. Thank you. I'm Dr. Humaira, member of quality team for the infection prevention and control. And today, Dr. Hajra has discussed already detailed the infection control program. So I will be going to discuss the employee health program along with the sterilization at primary healthcare centers. These both are actually the important parts of the infection control program. So I will start from employee health program. Okay. So every healthcare facility is a workplace that we are receiving and giving the care. So all the hospitals or the primary healthcare centers are the most important for the protection of both the patients and the employees. Employees and patients are the most important essence of the healthcare centers, okay? And healthcare workers are exposed to the complex variety of health safety hazards, including biological, physical, chemical, and radiological hazards. So it is very important to implement a program to protect both the healthcare workers and also the patients and the environmental safety. So what is the aim for the employee health program? The aim of developing the employee health program is to maintain our employees' well-being and health at its best. So we will perform the safe, healthy environment provided to the patient and for the staff and to get their best ability and productivity. If staff are healthy, they will be able to treat the patient and the environment will be healthier. So protect the patient also from contracting the communicable disease from the healthcare workers. So this program is mainly for the safety of the employees and along with that to protect the patients also. So how the employee health program works, I will discuss this in detail, all the requirement and everything that is we needed to implement this program along with the staffing and scope of service. So who are the healthcare workers? These are not only the doctors or the physicians who are working at the health centers, but all the paid and unpaid workers in the healthcare setting who have the potential of exposure to the patient or the infectious potential material, including any body fluid, contaminated supplies, equipment, any environmental surfaces that are contaminated with the any pathogens. So all the healthcare workers who are working in the primary healthcare and exposed to the any hazards. So this include all the physicians, nurses, technicians, dental personnel, lab personnel, even pharmacists, students, trainees, any volunteers who are working in the healthcare setting, including the administrative staff, managers, and housekeeping staff, all are included in the healthcare workers and have the potential of exposure to the hazards. So this program is implemented to protect for all. So the employee health program will work through the employee health clinic. Each health center must dedicate the suitable place for the employee health clinic. There should be a separate place that keep the confidentiality of all the records of the staff should be kept. So staffing include the employee health clinic physician and the nurse. The employee health clinic will work with the under the physician and the nurse with the specific place for the clinic at the primary healthcare level. So which services should be provided at the employee health clinic? Employee health program will perform its duties through the employee health clinic. That includes the record keeping, medical and occupational history of the all healthcare workers, including from the administration to the housekeeping staff. All the records should be kept. Pre-employment screening is done for each and every staff before employment, and periodic health examination, that whatever the investigations are needed according to the exposure of the staff or annually or biannually, it should be done. And vaccination according to updated international standards, all staff or healthcare workers should be vaccinated. Any management of needle stick injury and blood fluid exposure, if the staff is having any injuries or any sharp injuries or any blood exposure has been done. So management done should be according to the standards and guidelines, and post-exposure prophylaxis should be done, and follow-up record should be maintained in the employee health personal files. So post-exposure prophylaxis is that if the staff is having the needle or sharp injury, what you have to do. So it should be reported to the employee health clinic, and after the initial procedure, all the files or record of the vaccination and immunization status of staff should be checked in the file. That, for example, if the staff is having the injury with the needle and this patient status is unknown, so you will check the staff antibody status for the hepatitis B. Already it is checked in the record or no. If it is checked and staff is not immune, so you have to do within 22 to 72 hours. Post-exposure prophylaxis should be given, like immunoglobulin, and vaccination should be started immediately. But if the staff is immune, then hepatitis B and C HIV status we don't know. So for that, we have to do the follow-up. Follow-up should be done at the 6 weeks, 3 weeks, and 6 months to check that staff before it was negative and it is converted to positive or no, if the patient status is unknown. So this post-exposure prophylaxis should be done, and follow-up and treatment should be mentioned in the record of the employee health clinic. So any management of work-related injuries, occupational illness, and referrals as needed should be kept in the file, and training is required for all the healthcare workers to prevent the injuries or any exposure to any hazards has happened. Should be staff should be well trained to prevent these injuries. So what comes under the record keeping? Each employee should have a medical file. The employee health program will create a medical file for each healthcare worker, and all files are kept in a confidential and secure place. That should be separate from the patient files. There should be a medical record number should be given to all the files, and only the assess given to the employee health clinic physician or the nurse. They can assess the data or keep it confidential in the employee health clinic. And that file should contain the personal healthcare workers' biodata, initial medical history and examination should be mentioned in the file, occupational history, any vaccination record previously or the continuous annually in vaccination that has been given to the staff should be kept in the file, and result of all the pre-investigation and periodic examination or investigation should be kept in the file. So record of each employee clinic visit, work restriction or sick leave. If the staff has any illness or any exposure to any hazard, after that any sick leave has been granted, so it should be kept, record should be kept and mentioned by the employee health clinic physician in the record of the employee health clinic. And annual required investigations reminder should be given to the staff, and all the investigation should be done accordingly, according to the standards and guidelines. All needle stick or body fluid exposure incidents and follow-up record also need to maintain in the employee health clinic files for all the staff. The next is the pre-employment health assessment for all healthcare workers include what is the pre-employment, at which investigation or which examination to be done before or at the when the staff has been appointed in the center or in hospital. Complete medical history and physical examination should be documented. Complete occupational history of the staff, vaccination history, previously they have taken which vaccination, and occupational and medical history questionnaire should be filled by each healthcare worker, and investigation according to guidelines. So which investigations are required for the pre-employment before at the start of the duty, or you are starting the employee health clinic program in the PHC level? So at the baseline, which investigation are needed for all the employees? That is blood complete picture, screening for hepatitis B surface antigen, hepatitis C anti-HCV antibodies, anti-HIV should be done for all the staff, and serology, that is immune status for the hepatitis B, measles, mumps, rubella, and varicella is required for each staff. So hepatitis B vaccination immune status or the antibodies has been checked, but measles, mumps, rubella, and varicella antibodies according to the referral lab or in the hospital. If this is not available, so I will discuss later what you have to do if these immune status cannot be checked. TB screening and tuberculin tests should be done as a pre-assessment or pre-employment. And chest X-ray recommended for the workers with the tuberculin test or the pre-employment chest X-ray should also be done for the staff. This is the chart showing the pre-employment tests. So this is the same, the summarized form. Screening for hepatitis B, C, and HIV is mandatory for all the staff. Serology, that is immunization status for hepatitis B, measles, mumps, rubella, and varicella should be checked according to the CBI standards and MOH guidelines. Blood CBC, it is mandatory for the X-ray department especially. TB screening as a baseline tuberculin test should be done on hiring of every staff and should be repeated if the staff is negative annually. And chest X-ray as a pre-employment screening or after exposure to the TB, if the PPD test is positive, it should be done accordingly. So all the investigation you are doing has to be sending the sample to the referral lab to do investigation for the employees at the primary healthcare centers. But tuberculosis test should be done at the primary healthcare center, and it should be given by a trained person who can administer the PPD, the nurse who can administer the PPD solution to the staff, and also a trained person to read the results for this is required. So administration, how I will simply explain the how you will administer the PPD and how to interpret the result for this, for tuberculin test, because nowadays it is being done at the PHC level. So tuberculin sensitive test, PPD solution is administered 1 ml containing 5 TU of purified protein derivative solution. It should be given intradermally into volar surface of arm with tuberculin syringe. And you should keep in mind that avoid the area with the rashes, veins, or any excessive hairs. And aseptic procedures should be applied, like before giving the PPD solution, wash hand with alcohol rub or hand wash, and clean the area with the alcohol swab and allow it to dry. Then you can administer the PPD solution. And after giving the PPD solution, you should not cover it with the bandage or apply pressure. And recording of date, time, and location is very important. What time you are giving the PPD solution to the staff, so time and date should be recorded, and location should be marked on the arm. So you have to check the result after 48 to 72 hours. The staff should be informed. Healthcare workers should be informed that within 48 to 72 hours, they should report to the employee clinic to check for the results. So this is the picture showing the how to administer the PPD solution or DST test should be done. So now next is come the measurement, how you will measure the results after 48 to 72 hours. Measure the induration, that is heart bump rather than erythema. If there is redness or rash around the nodular swelling, you will not include that part into the measurement. Just palpate the area with the fingertips and measure the diameter of induration perpendicular to the long axis of arm. I will show in the picture next. Mark the edges of induration on the side and use the millimeter ruler to measure the distance between the 2 points. That how much is the size of induration. And after measuring, you should record date, time of the reading, and name of the person who is reading the DST. So this is the picture showing the induration along with the erythema. So do you think it is right method to measure this? Because this part is including the erythema. So this is wrong. You should just mark on the side of the induration like this in this picture. Okay, just mark the induration by palpating with the finger, and then you can measure the in between both points with the millimeter ruler. Okay, if induration is not there, you can record as a no swelling or negative or 0 mm. So now you have recorded that what is the record of the PPD test. So after that, you will interpret how will be the interpretation that the test is positive or negative. This should be considered under different circumstances. In which conditions you will consider that more than 5 mm duration, it is considered as a positive. More than 5 mm in duration is positive in all the contexts of the infectious TB patient. All the contexts who are directly exposed, like staff who is exposed to the TB without PPE, without wearing N95 mask. So in that case, you can consider 5 mm in duration as a positive tuberculin test. Or person with HIV infection, person with the abnormal chest X-ray. If the X-ray has been done before and there is abnormalities are already seen, so you can consider more than 5 mm as a positive. Or immunocompromised patient receiving the steroid therapy. But in which case you will consider more than 10 mm in duration positive, where the high prevalence of the TB or the TB is endemic and more cases are prevalent there. So you will consider 10 mm as a positive. Or patient with the medical risk factor, a staff with having the risk factor like diabetes or drug abuse, you will consider more than 10 mm as a positive tuberculin test. Or this is important that resident employees and staffs of the hospitals. So all healthcare workers are included in this category. More than 10 mm in all healthcare workers, you will consider as a positive. or the children under 5 years of age. The rest of the person without any risk factor more than 15 mm in duration is considered as a positive. So what key points you will keep in your mind while doing the TST, tuberculin sensitive test? Should not be administered to a person who has documented history of either positive result before or treatment for the TB has been taken for the staff. So that should not be performed the test on that person. And TST result should only be read and interpreted by trained healthcare professional. And all the positive tests, healthcare workers with a positive test result chest X-ray should be done. And the TST test is contraindicated with the history of severe reaction or anaphylactic reaction happened before after the TSTs. It should not be performed on those healthcare workers. So if the test, now you have interpreted the result and test became positive, like it is more than 10 mm, 12 mm, 13 mm or more than that. So what you have to do next? Clinical evaluation to exclude the active TB, to check for the any symptoms and signs of the staff is having any symptoms, or chest X-ray should be done. Baseline investigation, CBC and LFTs should be done for the staff and refer to the primary care consultant for evaluation and prophylaxis if needed. Some healthcare workers, they are not having any symptoms of the tuberculosis, but it can be the latent phase of tuberculosis. So should be evaluated and proper reference should be done and record should be kept in the file accordingly. So this was the pre-employment test. Now comes the periodic health examination, that when test should be repeated for all the healthcare workers. Test for the periodic health examination. Screening for hepatitis B, C, and HIV for all healthcare workers. It should be done annually for those routine baseline. It should be done and then repeat annually for those who are working in the high risk areas. All healthcare workers, physician, dentist, pharmacist, lab personnel, and all staff should repeat the screening for hepatitis B, C, and HIV. But immunization status for hepatitis B, measles, rubella, and varicella. If there is once documentation of the presence of antibodies for hepatitis B or measles, mumps, rubella, and varicella, IgG is there. So no need to repeat. Just keep the record in the file, and no booster is required for vaccination, and no need to repeat it again. Blood CPC count with the platelets should be done for the staff working in the radiognostic department or in the X-ray department. It should be done every 6 months biannually. Tuberculin test should be done baseline for all healthcare workers, or after the baseline you have done, so the staff who has been exposed to the TB should be repeated for them. Or all the healthcare workers with negative test result, you should repeat it annually. Okay, is it clear? And chest X-ray is recommended for the workers with the positive PPD test only. If the tuberculin test is positive, you should repeat the chest X-ray for them. So now the next is the vaccination. What is the vaccination needed according to the standards? Recommended vaccine help maintain the immunity and safeguard healthcare workers from all the infections, healthcare associated infections, and the other communicable diseases. Recommended immunizations are hepatitis B should be given to all the staff, 3 doses. Measles, mumps, and rubella vaccination, varicella, influenza, TB, and meningococcal. These are the recommended vaccine for all healthcare workers. So how often you will do give the vaccination? Hepatitis B for all healthcare workers, 3 doses, 0, 1, and 6 months. And booster is not recommended. You have to check the immune status or the antibodies. If the antibodies after 3 doses are coming negative, that is less than 10 MIU per ml, then you have to give another time the second session of vaccination. But booster is not recommended. Influenza should be given annually to all the healthcare workers. For MMR and varicella, without serological evidence of immunity or prior vaccination recommended. It means if it is not available to do to check the immune status, like antibodies for measles, mumps, rubella, and varicella here in the referral lab in hospital, they are not doing. So what you have to do, you will ask the staff to give the documented proof that they have taken the vaccination in the past. If they don't have any documentation of the vaccination for measles, mumps, rubella, and varicella, you should give the 2 doses of MMR and varicella 4 weeks apart. But it is not recommended in the pregnant or if planning to be pregnant in 3 months. TT, all healthcare workers regardless of age, and booster is required every 10 years. Meningococcal to all healthcare workers during the Hajj or working in high risk area like in emergency, single dose and can be repeated in 3 years. So after the vaccination of staff has been done, so what are the non-responders? All healthcare providers with the negative hepatitis B antibody titers, that is less than 10 MIU, we offered the second session of hepatitis B vaccine at 0, 1, and 6 months. So after the first session, like you have given the 3 doses and you check the antibodies, it became less than 10. You cannot label them as a non-responders. You should repeat the second session of hepatitis B vaccination at 0, 1, and 6 months, same schedule, and then you will check the antibodies after 1 to 2 months of the last dose. If again the second session is completed and you have checked antibodies, it became 10, less than 10. So then consider the healthcare practitioner as a non-responder. So should be constant recording precautions to prevent the hepatitis B vaccine infection and should not be posted in the area where there's the chances of exposure to the blood-borne pathogens. So this is about the non-responders. So this is all about the vaccination and the screening of the staff investigation required for the employee health clinic. So these are the forms that I'm showing to you to keep in all the files of the personal files of the healthcare workers. Occupational health questionnaire with the personal history, with all the state of present health, family history, and systematic review. This is the generally to be filled by the employee healthcare physician. If there is any history of any chickenpox, any disease related to neurological or any psychiatric or respiratory illnesses, it should be kept in the file. So next is the any history of tuberculin test or any blood transfusion or rheumatic fever you should document. Any allergies history should be documented in this file. The preventive history is important according to the standards of the CBI and also for the employee health program for the prevention of to any hazards. Tetanus vaccine, here you will document only if they have taken in the past, not in the recently you have given. This is when you was your last TT vaccine you have taken. PPT result when it was done last in the past. Have you ever had BCG vaccination? Yes. Measles, mumps, rubella vaccination, if they have taken in the childhood or staff remember that maybe they have taken in the 5 years or 6 years ago, you can just mention the year here. And history of childhood disease, yes or no. So according to that, varicella vaccination record also should be kept, should be written here, and hepatitis B vaccination staff when they have taken in the past. And accordingly, you will write completed 3 doses or not completed. Or what is the job status of the staff here, and this is the employment full-time or bridge equipment the staff is using. This next form is general health care emergency response questions. This is for all healthcare workers who has the chances of exposure to the blood or potentially infectious material, handling the sharp. So this questionnaire should be filled by the staff. Handling the any blood or OPIM or any CPR designated as a first aid responder. So lab personnel, this question should be asked from the lab person and the record should be kept in the file. Human products such as exposure of any plasma or the blood exposure, HIV or hepatitis B virus infected cultures, they are handling them. And there is any biohazard material that are used in the facility and disposal is properly done or no. They are using properly protective equipment according to the risk exposure. All the needles, syringes, blades are disposed of properly or no. These are all for the safety of the lab personnel and all these should be documented in the file. Waste material is disposed of properly and biosafety cabinet is there and disinfected properly after, in between, during the work. And all the procedures should be listed where there is the chances of exposure of staff to the blood-borne pathogens. This should be explained to them. The last 2 pages of the file of the employee health program is very important. This is the health record and the vaccination record. So mostly these are the standards for the CBI. They are related to these 2. for immunization and for screening. So this is the, this should be documented if the recently, but when you have done it, along with the date and the result of the hepatitis B surface antigen, and antibodies for the hepatitis B should be documented. Here, hepatitis C virus antibodies negative or positive, HIV negative for all. So measles, mumps, rubella, here you will document if IgG has been done. If it is not available, you can write not available and the staff has been vaccinated. So this record is the recently record, but you, according to the screening, you will fill it. And tuberculin test, what you have done in the center. So date should be mentioned here. This is first column is filled by the first time or pre-employment or when you have started the program. You will do the tuberculin test for all the staff and should be documented here. Tuberculin purified derivative done on which date and location, right or left arm, and what is the measurement? It is 0, 5 mm or whatever the reading is, you will mention here and interpret the result here that it is negative. For the second column, you will repeat for the staff if it is negative. So you will repeat after 1 year and will document all the record here. And then you will calculate the PPD conversion rate, that if the staff is converted from negative to positive, so conversion rate should be checked and document should be kept in the file. So this all forms should be signed by employee health clinic physician, medical director, and the approved by director. This is the vaccination record. According to the screening result, you will give the vaccination, what is needed to the staff. DT, if the staff in the history you have mentioned, they have taken in the last 5 years. So no need to repeat, just you can document which date they have taken. Meningococcal, every 3 years, you should document the date here. Hepatitis B vaccine, if you have checked already the antibodies titer, it is less than 10, then you will document here that first, second, and third dose, 0, 1, and 6 months. But if the staff is already immune, like antibodies are more than 10, then you will just mention here that staff is immune, no need for a vaccination. And this is second session of hepatitis B. Like you have first given already the hepatitis B and antibodies are less than 10. You will give first session 0, 1, 6. After 1 to 2 months, you will repeat again the hepatitis B antibody titers. If it is again less than 10, then you have to give the second session of hepatitis B vaccine. Otherwise, no need. Also for MMR and varicella, as I have explained before, that you should give 2 doses if the immune status cannot be checked or staff has no document proof for the previous vaccination. So you have to give the 2 doses. And influenza vaccine yearly should be mentioned. So this is all for the vaccination record. And next is the form for the tuberculin test. This tuberculin test should be performed at the PHC. Like there's 2 forms for the sector for King Khalid Hospital and Specialist Hospital, Fahad. So these 2 forms should be filled by the person who is taking the reading or who is the trained for doing the interpreting the result. So the result should be mentioned here. Do not only write take negative or positive. You have to mention the reading. If it is 0, also no induration, you will write here 0 mm. Okay, then should be signed by the person who has interpreted the result and with the approval from the director. Next slide is showing the how you will check the PPD conversion rate. So PPD conversion rate should be checked annually for all the healthcare workers with negative tuberculin test. For the centers who are going to start the program for employee clinic, like recently 4 months or 6 months ago, they have started. For them, they cannot calculate the PPD conversion rate. After 1 year, they will repeat the test for all the healthcare workers with the negative PPD test and will see for the conversion rate. But all the centers who has implemented 3 years ago, the program is already going on, and they have checked annually for the PPD test has been done for the staff. For those staff, you will calculate the PPD conversion rate. Number of conversions mean how many staff before it was negative, now it has been converted into positive, divided by the total number of staff with the negative PPD test. So by this way, you will calculate the percentage of PPD conversion rate. Same applies for the seroconversion rate. This too I am explaining because these are the documents required for the standard for IPC for the employee clinic. So seroconversion rate you cannot calculate in the if there is no conversion from negative to positive after the needle injury. But if there is a cases of needle stick injury, you should repeat. Follow-up should be done for the 6 months, and after 6 months, you will calculate the seroconversion rate. Like same, how many staff has been converted from negative to positive, divided by total number of staff who has the needle stick injury. So like that, you will see the seroconversion. So the vaccination you have given and document in the personal file of each employee. There must be a register for immunization to keep in the employee health clinic with documentation of all the vaccination that has been given to the staff, along with the stamps from the vaccination department. So these are all the vaccine that is required. I have already discussed. So this just form to show you that the immunization register to be kept in the employee clinic for the record for immunization for all the staff, and should be repeated accordingly if it is needed later on. So for the reference, there should be a manual for the staff health clinic. All the policies are already included in the infection control IPC manual. So the policies that are related to the employees should be kept along with all the forms. These are the policies required in the manual for the employee health clinic, along with the organizational chart, mission, vision, and value, scope of service for the employee health clinic, and then immunization policy, employment, periodic health examination policy, blood spill management policy, safe handling of shop, management of needle stick injury, blood and body fluid exposure, and any healthcare workers exposure to open TB policy. There must be a policy if any exposure to the other communicable disease like measles, mumps, rubella, or varicella. And all the forms related to the employee health file should be kept there. So in the next slides, I will just discuss about the document review and the observation that is related to the employee health program. So these are the standards for the CBI for IPC 23. The document review, as already discussed, I have discussed the policies for the manual for the employee health clinic. IPC 23, evidence of compliance 1. So that policies should be included in the standards file. So IPC 23 EC2, response to the hepatitis B vaccine is monitored in vaccinated employees, and non-responders are offered at least a second series of vaccine. So this document should be kept in the file for the standards, and also in the personal file, that how many staff are with the negative antibodies titer, and they have offered at least a second series of vaccination. So IPC 23 EC3 is employees are screened for TB upon contracted with PPD test, and the test repeated annually for those who are not reactive. This is also referred to the personal file, that all the staff as a pre-employment PPD test has been done for all the staff. So next is the IPC 24, also related to the employee health clinic. So IPC 24 EC1, they are the policies on the identification of exposure to TB, varicella, and sharp injuries that I have already shown to you, with clear procedure for post-exposure management. So post-exposure management appendix along with these policies should be kept in the file. Infection control staff report and monitor the incidence of exposure of staff to open TB, needle prick, and sharp injuries, chickenpox, measles, mumps, and rubella. These are all the reporting should be done. If any staff is having exposure to any tuberculosis or measles, mumps, and rubella case, or needle stick injury happen, that record should be kept in the file, and reports should be attached annually. Also, the form should be kept in the file, and also along with that, the monthly reports should be added and follow-up record should be kept in the personal file. And also IPC 24 EC3, there is calculation of aggregated data on PPD conversion rate and sharp injuries. This is applicable for only those who have implemented the program 1 year ago. That PPD conversion rate can be calculated after 1 year for the negative staff. And sharp injuries also, if there is any incidence of any sharp injury, so seroconversion should be calculated as I've discussed before. So these were the documents, and the personal file, refer to the personal file in IPC 23, EC4 and 5. Employee health record reflect the required staff immunization. The required immunization record should be kept according to the policies, like hepatitis B, influenza, measles, mumps, rubella, and meningococcal vaccine should be given along with DT. And immune status of the employees against hepatitis B, measles, mumps, rubella, and varicella should be determined by the serological testing. It is actually the requirement to do the antibodies for the hepatitis B. Also, measles, mumps, rubella, and varicella IgG should be kept. But unfortunately, it is not being done here. If it is possible, try to do. But if it is not possible, at least document the vaccination that measles, mumps, rubella, and varicella immunization has been given to the staff. So next comes the observation. The vaccine is available according to the staff immunization policy. There should be enough stock for all the vaccination that is recommended according to the guidelines for the employees should be kept in the file. Should be kept in the vaccination room. Sorry. If there is any references for this, the GCC guideline for infection prevention and control, employee health clinic physician can keep the reference from the GCC guidelines for infection prevention in that occupational or the employee clinic chapter that can be referred to that, and MOH program and policies are the references. So this is all for the employee health program. So next shortly, I will discuss the about sterilization at primary health care. So if you have any queries or any questions regarding this employee health clinic. So now I will continue with the sterilization at primary healthcare. This is the very important essential safety requirement for the primary healthcare centers. All the primary healthcare centers should have a sterilization department according to the policies and standards. But if this is not available, you have to make the contract with any accredited centers. They are having the sterilization room according to the standards, because this is must for the safety of the centers. So sterilization is very important, and it must be done according to the infection control guidelines. Cleaning, sterilization, and disinfection of the equipment and instruments should be done in a safe environment. So all the cleaning, disinfection, and sterilization should not be done in the clinics, like in dental clinic or emergency. It is totally prohibited to do the cleaning or even rinsing or washing of the instrument inside the clinic. It should be kept in the closed container with the transportation gel or pre-clean gel and sent to the relevant department or other PHC according to the availability of the sterilization room. So what is cleaning, disinfection, and sterilization? These are the three processes for the sterilization. And I will just explain what is the cleaning. Cleaning is the process to reduce the number of microorganisms by physically removing the debris, just only washing the contaminated part from the instruments. And next comes the disinfection. Disinfections mean, my sound is clear?
Yes.
Okay, thank you. Disinfection process will destroy the microorganisms, disease-causing organisms, but not all the microbes. But sterilization process will kill all the microorganisms, including spores, viruses, and bacteria and fungi. So sterilization is very important. And the sterilization unit should be according to the standards with the structural and functional specifications. All the personal protective equipment should be available and used during decontamination, like heavy-duty gloves, waterproof aprons, face masks, goggles, or the face shield. And the sterilization staff that is assigned for doing the sterilization should have adequate knowledge and proper training for this, and should be certified for work in the sterilization unit. And cleaning, disinfection, and sterilization of all the equipment should be done in the sterilization unit and not in their respective department that I have spoken before. That should not to be done. It should not be done in the dental clinics. Autoclave should not be kept. There should be a separate designated place. According to please unmute your this. Thank you. Cleaning. Cleaning, disinfection, and sterilization of medical equipment should be done in the sterilization unit, not in the respective department. And in the sterilization,
أصبر.
can you please unmute your mobile? Or thank you. There is unidirectional flow of traffic from dirty to clean. For the sterilization room, there should be a unidirectional flow, that from dirty to clean area and then to the sterile area. Decontaminated area, packaging area, and sterilization and storage area should be properly according to the standards. Okay. And dirty area is only for receiving and cleaning the instrument. Clean area for inspection, wrapping area, and loading of the peel pouches, and sterile area where unloading of the pouches and storage should be done. And all the records should be done properly, and record should be kept at least for 1 year. These are the record or the indicators that are required for sterilization. Chemical indicators should be used in every package or each pouch, it should be kept. Biological indicators that are used weekly, and bovidic indicators daily. And records should be kept at least for 1 year. Sterilizers should be in a good working condition, and all the records should be kept in the file, and instructions are available for all the sterilizers, and maintenance records should be kept in the file. So this is the just showing the unidirectional flow of traffic, like there is entrance to the dirty area, then clean area, sterile area, and then transfer to the instruments out of the sterilization room through another pathway. It should be unidirectional. Okay. In PHC level, there is 2 types of sterilization units. I will show just the structure from here. This is the entrance point. Here should be a cabinet for the PPE and hand washing sink before entering into the contaminated area. All the PPE should be worn. And then there should be 2 sinks here for washing the instrument. One is for rinsing and one is for cleaning the instrument. Okay. After that, there should be another hand washing sink. After before going out of the contaminated area, PPE should be removed and hand hygiene should be done. After that, there should be a complete separation in between the contaminated and clean area. You can see here will be a window to transfer the instrument from dirty or contaminated area to clean area. And all the indicators should be kept in the closed cupboards, and pouching and packaging and observation should be done here. If there is any contamination or any debris is there on the instrument, it should be sent back to the contaminated area. And packaging along with the proper integrated package, self-adhesive packaging, and a record should be kept here along with the dates and time should be mentioned on each pouch, and then should be sent to the sterile area to put into the autoclave. After unloading and unloading from the autoclave should be sent either to the relevant department, or there should be a storage area to keep the record there. This is another type of structure for the sterilization unit at PHC. Like in Suleimania and Nahda, the structure is like that. So here is the window to receive the dirty instrument from the PHC in the closed container, and staff will enter from here, from this way, and there should be 2 sinks. One sink in the start for washing the hand, then 2 sinks for washing the instrument for contaminated and for rinsing. And here there is no complete separation for in between clean and dirty area, but there is separation between sterile and this area. This is also acceptable, but there should be a sink in between contaminated and clean area. PPE should be removed in the contaminated area, and after that hand washing done, and then all the packaging of the instrument should be done in this area. And then after the packaging, through the window, all the instruments should be transferred to the sterile area, and there should be a door here to go into the sterile area. After that, unloading of the instrument done, and there should be a cupboard for record keeping and for saving the instrument, and then sent into the proper departments separately. This is the picture showing the sterilization room at PHC. You see here is the sink for, this is all the essential safety requirements according to the points for ESR for sterilization. So this is the sink for washing the hand, and then 2 sinks. There should be a specified measurement that 2 sinks should be used. One is for rinsing and second is for the cleaning and rinsing. And there should be a proper depth, 350 mm. Both sinks must be large enough to allow the merging of largest appliance to be cleaned. And there should be a sharp container if anything sharp to be disposed of properly in the sharp container. And the color coding should be done according to that. Red for the dirty or contaminated area, yellow for the clean area. After that, packaging should be done here, and there is also a sink for hand washing, 2 sinks for hand washing and 2 sinks for washing of instrument. And there should be a closed cabinet to keep the stock inside the cupboards. So then this is the autoclave. There should be a self-adhesive pouches, or if self-adhesive pouches are not available, then you have to keep the machine to close the packages properly, and integrity should be maintained. And these are the autoclaves being used in the PHCs. This is the same picture, just this napkin for the drying of the instrument. And this is the record keeping area at the sterilization unit for keeping the record or any sterile instrument that can be stored here. So what record is required for the sterilization units? You have to keep the record for all steam sterilization. Loading sheets should be kept istilam taslim, like sending and receiving of the instrument record should be kept at least for 1 year. By bovidic and biological indicators is very important to be used daily and weekly, and record should be kept, and all the documentation should be done accordingly. This is the picture showing the chemical indicator. This is the indicator that should be kept in each pouch. Okay. And this is also a chemical indicator, but this should be done, kept in the sterilizer in the empty cycle. Before putting the instrument, first empty cycle, you will keep the, every day the bovidic indicator should be kept, and the result is coming like this. And all the papers should be kept in the file for record. Like every month you need at least 20 plus papers for this chemical indicator. If it is white and black and clear, it means that the autoclave is functioning properly, steam distribution is good. But if there is haziness, like there is yellow and this is not clear, so it means that steam distribution is not good. So you have to repeat the instrument cycle. You cannot sterile the instrument in that and ask for the maintenance. This is the biological indicator that is used weekly. There is spores inside, so this biological indicator should be kept along with the instrument in the autoclave. Weekly it should be done, and should be kept in the place where there is the less distribution of steam, in the lowest part. So you can check that all the germs are being killed during this cycle. If this biological indicator should be kept in the pouch after putting in the autoclave, and check if the device for the checking the result for the biological is available at PHC, you can do at PHC, but usually the machine is not available. So you have to send the biological indicator to the hospital. There should be ittifaqiyya or contract with the hospital for the biological indicator, like from Suleimania to King Fahd Hospital, it should be done. And weekly you have to send in the pouch with the label date to the hospital according to the contract. So when the result is coming, you will document here the date of the biological indicator, like it is weekly. So this is a paper for month. So you can keep all the record here, date, autoclave number, what time you put in the inside the autoclave, finishing time, and the cycle. It is a biological test passed or failed. You will get the result from the hospital. After that, you will fill it passed or failed, and operator name, and with the signature and comments you can write. These are the papers that is showing the result from the biological indicator from the hospital. So along with this letter from the hospital khitab, they must send the auto reader paper from the machine that the result is negative, what date it was checked and it became negative. So these two papers are required from the hospital. So biological indicators weekly you are doing, and the record should be kept in the file for at least 1 year. Bovidic test sheet for the steam sterilizer, this should be done daily according to the autoclave number. If you have autoclave 1 or 2, you will mention here starting and finishing time. This is the morning first cycle you are putting in the bovidic in the autoclave. So morning time first, before sterilization of any the instrument cycle, you will keep the empty cycle with the bovidic indicator. So the result is passed. If it is clear black and white, it means it is passed. So you will write here, and operator name and signature should be done. This is the result. This is the forms that you will keep all the paper of the bovidic test daily should be kept in the file. record should be maintained, and this information should be recorded here. Along with that, the loading and unloading of the instrument, this should be done and recorded here, like autoclave number, cycle number, in which department, from dental clinic, Tawari or Asnan, or if it is with the contract with the other hospital, so you have to write here the PHC name, which PHC, like any other PHC, they are setting instrument for the sterilization, number of instruments and loading time, number of cottons, unloading time, and signed by the operator who is working in the sterilization unit. And the cycle also should be mentioned, it is passed or not, that all the instruments should be properly sterilized, integration should be checked, and there is no steam inside, or there is no integrated proper pouches are properly packed, and there is no pores or nothing has been damaged. So after this is the receiving and sending form of the sterilization. These are the receiving and sending record to the sterilization department before sterilization and after sterilization. This record also need to be kept for the in the sterilization room. Then there must be an infection control supervisor who will check the sterilization room that it is properly functioning according to the standards, or if there is a contract with the outside PHC, the team from the PHC will go to the contracted PHC to check the standards are being maintained for the sterilization unit. So this is all the checklist that should be kept monthly in the file. CSST staff is well trained and qualified according to all the procedures and is vaccinated. So you have to write here done. So this is all the traffic design area for the physical separation of all the areas. All the walls are can be disinfected. There's a unidirectional flow, like I have discussed all the parameters for the structure. Next is the receiving area. The dirty instruments must be transported in the closed container. If you are transporting from one facility to another, it should be properly labeled with the biohazard sign inside the container, that it will not cause any damage to any healthcare worker or any person. So heavy duty gloves or PPE being used in the receiving area or contaminated area, and shop containers are there. Decontamination and cleaning area, 10 air exchanges or negative pressure should be maintained. Staff is wearing the PPE and decontaminate items properly. And this all the decontaminated area standards should be checked. Packaging area should be also, there should be a negative pressure in decontaminated area, and in the packaging or the clean or sterile area, there should be a positive pressure. So this also should be checked. Inspect items for the proper cleanliness, inspect for the proper functioning. Any rusty items should be replaced, and separate area for sorting and fine folding of linen if the linen is available. Check sterilization containers for the integrity, and also inspect items with the label with the sterilization date. The label should be kept on the transparent side of the pouches. Sterilizer is in a good condition. Instructions and maintenance record for the sterilizer should be kept. Use the indicators routinely and use the correct method of sterilization. Sterile area design should be separate, limited SS area. Only the staff who is responsible for sterilization can enter in that area, and there should be a temperature and humidifier monitor in that area. The storage area, according to the standards, it should be kept, and disinfection of all the carts and every surfaces should be done regularly. And record that I have spoken before for daily steam sterilization test, instrument checklist for counting, and also the receiving and sending forms should be kept for 1 year, and quarterly maintenance record of the equipment should also be maintained. And this checklist should be signed by the infection control supervisor and also the staff who is responsible in the CSST unit. That should be signed. This sterilization contract outside the that was the standards for all the if the sterilization is being done in the PHC. But if you don't have any standardized sterilization unit, so must prepare the contract with the other PHC that is all accredited for the SEBI, or there is a sterilization room up to the mark. So signed by both from the center and from the contracted facility should be done. And if you are doing contract with any other PHC, there should be a separate policy for cleaning and disinfecting tools and instruments outside the PHC. For internal policy, this should be kept along with the other policies. And this is the paper for the Ittifaqiya with for the biological with hospital. So this is needed for the staff where the sterilization room is functional, but biological indicator result cannot be checked at the PHC. So contract should be done, signed from the hospital and PHC also. This is for the biological indicator. Okay, and the record I have shown you before. This is the biological indicator result. Record should be kept. Okay. Next is the bovidic test. This papers I have shown you. The record from the hospital. If you have contract with the Suleimania, you have to keep these papers in the file along with the original stamp from the Suleimania, like the same bovidic test. There must be a letter from the director to the PHC that they are bound to send the results of all the indicators and all the record to the PHC monthly. So this is the monthly sheet for the bovidic test. At the end of each month, you have to collect this from the contracted PHC along with these papers for every day. The original stamp should be kept on this. So next, these are all the important points for the sterilization at PHC level. So these are the essential safety requirements for the IPC related to sterilization. So the first point I have already discussed, that cleaning sterilization should be done in the sterilization unit with the unidirectional flow, and double sink for washing of the instruments, like one for the decontamination and one for cleaning. There must be 2 sinks for washing of hands, and enough stock should be available for the washing, for disinfection of the instrument, and for cleaning. Brushes and disinfectant chemicals should be available. Self-adhesive sterilization pouches must be available in the sterilization unit. There should be a permanent marker. Permanent marker mean like if you are putting labeling the instrument with the date, and if you put in the autoclave with the steam, it should not go off. So permanent marker, usually there is a gun, auto gun, so you can put the stickers on the transparent side, so it will not disturb the integrity of the pouches. It should be maintained. So thick disposable napkins for drying of the instrument. It is blue or green color. It is available in the PHCs. Loading and unloading of the autoclave. A record should be kept, and loading and unloading should be done according to the standards. So there should be proper cupboards for keeping the record and all the stock for the cleaning. It should be in the closed cupboard. And temperature and humidifier monitor should be kept, and record should be maintained. Temperature should not exceed 24 degrees C, and the humidity must be less than 70. It should not exceed the 70. So this is all the for the essential safety requirement for the sterilization. And next is also IPC 22. This is EC5, also the essential requirement for sterilization. This is record keeping, that I have already discussed this before, that chemical indicators should be kept in each pouch, and bovidic indicators documentation should be done properly. There is the already the use of biological indicator record should be available, and documentation of the performance record also should be done properly, that I will show in the next pictures. All cleaning and sterilization is performed in the sterilization unit. Like Tanzeef, Tatir, and Takim should be in the sterilization unit. There should be a proper separation and coding of the sterile, dirty, and contaminated and clean area. And this is the window that is for receiving and sending the instrument. And this should be only one-way traffic, like staff from the inside can open this, and the closed containers instrument should be transferred to the sterilization unit. And this is already the essential requirement. I have already told you about 2 sinks and closed cupboards for hand washing and rinsing of the instrument. Brushes and disinfectants should be available, and loading and unloading should be done properly. And there should be a record of paper from the autoclave. If it is not available, the record should be written by the staff in the sterilization unit. They should maintain humidifier, and there should be a humidity monitor and the temperature monitor, and the record should be kept and also displayed in the sterilization unit, and the previous record should be kept in the file. This is all the essential requirements for the indicators. Chemical indicators should be kept in each package, biological indicators weekly, and bovidic indicators should be kept, should be done daily, and all the efficacy of the sterilization cycle printouts monitoring indicators record should be kept for this. This is the chemical indicator to keep in the pouch, and there is some pouches that have the self marker is there already on the pouches. So it should be like this, and also the bovidic indicator before and after result should be like this. This is the biological indicators and the biological indicator reading machine. If it is not available, there must be the contract with the hospital. So this is all the essential safety requirements related to the sterilization room. So all the records should be kept, and this should be done properly. Thank you so much for listening. If you have any question,